Run, river, run, run through the hills. Run, river, run to the sea. Run, river, run to your place beneath the sun. Run, river, run over me.
Hi, this is Janet Lewis. Welcome to be my guest today. We have from Milford, we have Ed Roth, and he is a Shine program assistant, right? Am I right about that?
That's correct.
For Shine in Milford, and it's all over the lot. But a lot of people don't know what Shine is. Ed, can you tell us basically what it's all about?
Yeah, SHINE is an acronym for Serving the Health Information Needs of Everyone. We used to be known as Serving the Health Information Needs of the Elderly. What we do basically is we explain the very complicated Medicare program to seniors. And seniors and also people with disabilities who become eligible for Medicare when they're younger, if they're disabled, you become eligible for Medicare when you're after 2 years of disability.
Right.
And the SHINE program gets people in, and we can answer any questions they have about this very complicated program.
Yeah.
Right now, we're going through an open enrollment period.
I saw, yeah.
And this this is the one time of the year when people can change their Medicare plans and change their Medicare options. So we want to be sure that folks have that, the ability to make really educated decisions on what they want to do for the next plan year.
It is a complicated mess. There's a TV commercial, and I've seen it. You've probably seen it, where the couple is coming to the beginning. It looks like a maze, and they're like, "Where do we go?"
That's correct. It's very complicated, and again, we have in Central Massachusetts, the Milford office is the regional program for Central Massachusetts. In Central Massachusetts, we have 60 SHINE counselors that are available. They're all volunteers. They're available free of charge, and they're located basically in senior centers throughout Central Massachusetts. Here in Upton, we have a counselor down at the Upton Senior Center,
That's right.
and we also have another counselor that goes there periodically as well and does appointments and sees people from Upton. We like to keep it as local as possible because that's where we feel that people can best get the services right there in the senior center. At the Milford office, we handle up to 3,000 calls a year over the phone with people making inquiries about their Medicare program and different questions they may have about how it works and what options they have and co-pays, deductibles, whatever questions they have, we try to answer those questions.
How old? This is so confusing to me. At what age are people definitely considered for Medicare?
Oh, we're in basic stuff. That's great. If your eligibility for Medicare is for generally at the age of 65. Okay, that's when you have to apply for Medicare. How do you apply for Medicare?
They have to? Literally.
They're eligible for Medicare. Let me put it that way.
All
Okay. Now, what happens is this, okay? If you're working, if you're going to continue to work, you're going to be 65, you continue to work, you have health insurance through your employer, you don't have to apply for Medicare. You can continue to get your Medicare through, get your insurance through your employer.
Well, many people are not even retiring yet. They just keep on going.
What we recommend, though, is that people contact Medicare at 65, right around their 65 birthday, and sign up for Medicare Part A.
What is that?
Medicare Part A is hospitalization.
Okay.
Many of our viewers will have their Medicare cards. They can take a look at their Medicare cards, and they can see Medicare Part A, hospitalization. That covers the hospital.
Yeah.
Medicare Part B covers their doctors and outpatient services, maybe even doctors in the hospital. If you're having a surgery, that anesthesiologist may be covered under Medicare Part B. So maybe even some services in the hospital Part B expenses.
But do you get that automatically when you sign up?
Part A you get automatically.
Okay.
Part A you get. Part B you can defer if you're continuing to work.
Yep.
Part A is free. We pay for Part B through our active employment, through our work history.
Sure.
That comes out of our check. It's called the Medicare tax.
Yep.
That pays for Medicare Part A for everyone. Medicare Part B is something we're going to pay for when we pick up Medicare Part B. This year and for 2018, the premium for Part B will be $134 a month. For most people,
That's not easy for those.
no,
on
it
increased
isn't.
income. What the heck?
It's $134 a month. For most people,
Yeah.
it's deducted out of their Social Security check.
Yeah, sure.
Um,
Which is still like this for a lot of people.
it's tough, but if you're low income, if your income is below $1,377 a month gross income,
Yeah.
you can get help from the state to pay that Part B premium.
Would that be Mass Health?
It'd be a Mass Health program.
Yeah.
It's called Mass Health Buy-In, or a Medicare Savings Program that's run by Mass Health, and they'll pay that Part B premium if your gross income is below that level.
Sure,
So
yeah.
there's assistance for low income folks, and that's really helpful. For other folks, if you're above that level, you're going to have to pay that $134 a month for that Part B
Wonderful.
once you sign up for Medicare Part B. The A is free, as I said.
Yeah.
So
The B is the one where you're going to get.
the B is the one where you're going to have to get a deduction
Yeah.
out of your Social Security check.
Now, you've got a lot of different plans. This is mind-boggling. Ed was gracious enough to bring this in because I couldn't tell you what they are. Aetna, is that a good one?
Aetna's a new plan. Aetna's a new plan in the area, and it's just started out this year. And it's we want people to investigate it. Let's see what it looks like, because we don't really have any experience with the new Aetna plan. But it's a new plan in the area, and it's a Medicare Advantage plan. And if I can, Jan, let me explain the types of plans.
Oh, definitely, yeah.
Medicare Advantage plans are your typical health maintenance organizations and PPOs. Generally, they're run by Tufts Medicare Preferred, has Medicare Advantage plans. Blue Cross Blue Shield has HMOs and PPOs.
What's a PPO?
PPO is a preferred provider organization.
Okay.
Okay, we can throw these out there. I know the acronyms are painful.
I know.
But-
HMO.
Health Maintenance Organization.
Okay, all right.
Okay?
Got it.
And again, and let's see, we have, and Fallon Senior Plan has HMOs, and Harvard Pilgrim has HMOs, Blue Cross Blue Shield has HMOs and PPOs. Again, a health maintenance organization, closely networked. It's a closely networked plan. You have to stay in the network to get your services.
That's the bummer if you don't
Yeah,
want to.
It's a bummer. Can be a bummer. You go out of network, they're not going to pay the bill unless it's an emergency or urgent care. With a PPO type of plan, your primary care physician should be in that plan. But you can go out of network with a PPO, but you're going to have to pay a little more money in most plans for your services.
Why is there so much competition in this to get the different insurance plans? Why?
It's just the nature of the business, and it's not as bad here in Massachusetts as it is in some parts of the country. Talking a minute about supplement plans, which is a whole different way to help with your Medicare.
Right.
But with the HMOs, again, what happens with HMOs is this. You sign up for Medicare A and B, and then you want to get your services through a Medicare Advantage plan, one of those plans I mentioned. What happens is this: you join that plan, you may pay a premium, and then what happened, and you still have to pay your Medicare Part B premium as well.
That on top of it.
On top of it, the Medicare, everybody has to pay the Medicare Part B premium.
Unless they're on, like, say, with Mass Health.
Unless they get some help
Okay,
paying it.
all right, yeah.
The Medicare Part B premium is the entry fee for most of this stuff.
Oh,
Okay? So you're getting things. So you get and then you get an HMO.
yeah,
Now they have zero cost HMOs available,
yeah,
but it's a zero plan, so you got to look at what you're going to get for a zero plan.
yeah.
But what happens is this: Medicare, and once you join, Medicare pays that plan X amount of money a month to take care of your health care. They may send that plan $600-700 a month to take care of all of your health care needs.
That's not enough, though, for people who need surgery.
Well, it may not be,
No.
but Medicare sends them that money.
Yeah,
So that's 12 months a year.
yeah.
So that's maybe $8,400 a year. They send the
All right,
plan.
it accumulate, okay.
It accumulates.
Yeah.
It's accumulative, and then that plan becomes your primary care.
Yeah.
Medicare is no longer responsible for your health care. So you get all your medical services through that plan, including your medications. You get your medications through that plan as well. So it's a broad plan. It's a very good idea for some folks. There's no deductible for the plans.
Mhm.
There's co-pays, but there's no deductible for the plans.
Oh,
There is an out-of-pocket limit for the plans. In other words, there's a certain amount of money a year where if you go over that amount of money in co-pays and deductibles, you will no longer have to pay any co-pays. Okay?
I hadn't heard of that one.
I'm going to tell you about it.
Wow.
It's a lot of money.
Where did you learn all this, Ed? How did you learn all this?
I learned all this through the experience of 12 years of experience doing this, and also all of our counselors, our certified child counselors, they have to go through a 10-day training program, and they're recertified each and every year. So these folks know their stuff. Again, this is complicated stuff.
Very.
These folks know their stuff.
Yeah.
So again, to get back to the out-of-pocket limit. So in a lot of that out-of-pocket limit can be anywhere from $3,400 a year to $10,000 a year.
Oh,
So if in any case, to hit that out-of-pocket limit, you have to be having kind of a bad year.
yeah.
So medically, you know how to hit that out-of-pocket limit, because you have to maybe a couple of times in a hospital, this, that, and then after you do that, your care is free. But a lot of people won't hit that out-of-pocket limit, and they'll continue to have to pay their co-pays and stuff like that throughout the year. But again, the important part about the HMOs in particular, your doctor has to be in the plan. This year it isn't too bad. Not a bad open enrollment, because there hasn't been any big provider changes.
Yeah.
A couple of years ago we had a provider change with Reliant, and they went from Fallon Senior Plan to Tufts Medicare Preferred. That was a big change for over 13,000 people that had to go through that exchange. So
You
that
must see a
changed.
lot of people wringing their hands and really, really upset when they come to you, I would think.
It gets difficult for people, but we kind of calm them down. We'll do a whole myriad of things. We'll look into somebody's drug plan, Part D plan, if they have a Part D plan, to see if their Part D plan is going to meet their needs.
I was just going to ask you,
for
what is
2018.
What is Part D?
Part D is Medicare. Part D is a program that was conceived back in 2005. It helps with prescription drugs. So there are 22 plans available in Massachusetts that an individual can join, and as long as they're not in a Medicare Advantage plan. Now, the Medicare Advantage plans have their drugs within the plans. The drugs are included. But if you get your Medicare through another source, maybe you just have A and B, you're not in a Medicare Advantage plan, you need to have some coverage for your medications. That coverage would come through what we call as a standalone Part D program.
How much per month?
It depends. It depends on your medications.
Oh.
And it's all medication targeted. So what happens? Somebody will call.
Yeah.
What's my Part B gonna cost me this year? We'll send them out one of our search tools. They'll provide us with their med list. We'll run it through the Medicare.gov system, and we'll come up with the 3 least expensive plans for them. we may target a plan that we feel may best meet their needs, and then we'll reply to them. So that would hopefully be able to, then they can call the drug plan or Medicare and join that particular plan.
I think this is great.
And-
A lot of help right here. Yeah, definitely.
And then they can join that particular plan.
Yeah.
Again, if you need that kind of service, you can call 1-800-AGE-INFO, and we'd certainly be able to send you one of our drug searches.
Ed, how can somebody reach you if they have questions?
If they have questions, the best number to reach us at is probably our local number, and that's 508-422-9931. That's the number up at our office, and also that 1-800-AGE-INFO number certainly can reach us as well, and we can certainly answer any questions you may have regarding your Medicare or your Medicare options.
What's Medigap?
Medigap or Medicare supplement plans, Jan, and what they are, as I said, when you have the HMO, that replaces your Medicare. If you want to keep your original Medicare A and B, and that can be your primary, okay, you have deductibles and co-pays with Medicare.
Right.
Built into A and B. So if you don't have any other, Medicare's hospital deductible for 2017, I don't have the 2018 numbers as yet, but for 2017, the hospital deductible for Medicare Part A is $1,316. If you're admitted to the hospital and you have no other insurance, you're going to have a deductible of $1,316 that you'll have to pay at some point.
I'm wondering, Ed, if you've heard of this little, I wouldn't use the word scam, but I warn my friends, when you go over to the emergency room and they keep you a while and they say, well, we're going to put you into observation overnight, 9 times out of 10, the insurance company won't pick it up if it's observation. It's either you are in the ER or you're admitted or you're going home. That's what I found out, and that's awful. Just awful.
If you're in the hospital, it's a good point to bring up, Jan. Thank you. If you're in the hospital under observation, you're not admitted.
Yeah.
You're in the hospital. What happens in that situation, and you have Medicare A and B.
Yeah.
Medicare Part B will pick up that bill.
They will.
Yes, they will.
But
That's
the other
all under
insurance,
Medicare
if
Part
you're not
B.
on Medicare, though, what I've warned my friends, like if they're not there yet, on Medicare,
Yeah.
I'm like, don't let them put you over to observation because you're going to get the bill.
That depends on the commercial policy. I wouldn't know what it is, but with Medicare, and it's a dangerous bit of business, to be honest with you, because you're correct.
Yeah.
A lot of hospitals nowadays will put you in that ER. They might wheel you out into the hallway.
Oh yeah, for hours.
And they may even give you a bed.
Yeah.
I've experienced clients where they've been given a bed and they're still under observation. Well, okay, that's fine, but in the case where you may need to go to a rehab or something like that, guess what? Medicare will pay for the first 20 days in a rehab as long as you've been admitted to a hospital for 3 midnights. So if you haven't been admitted to the hospital, you're going to get dinged for that stay in the rehab.
Even at Medicare,
even with Medicare, you have to be admitted to a hospital.
3 straight days.
3 straight days, 3 overnights.
Oh my God!
So
a lot of people don't know this, Ed.
Well, if you're not, we tell that at all our meetings when we talk to folks. So it's important that when you do go into the hospital, that you clarify as to whether you're being admitted or not, just in case you may have to go to a rehab. Most folks don't. I acknowledge that, but we just want to make sure we're in an admitted status if we can be. Okay, very important. And I was talking about deductibles. You asked about Medigap. I want to stick on my train of thought. So we have these deductibles with original Medicare, which is $1,316 for the hospital, $183 for Part B, and then 20%. Medicare pays 80% of a typical doctor's bill, and the beneficiary pays 20%. Doctor's bill of service could be a procedure, could cost $2,000 or $3,000, could cost $10,000 for a procedure. Medicare would pick up 80%. The beneficiary would be responsible for 20%. That's a lot of money.
Yeah.
So we have Medigaps.
Yeah.
Now, a Medigap, what we have is two types of Medigaps. We have core, we have supplement one. A supplement one Medigap would pick up all of the costs that Medicare doesn't pay. It's expensive, but you won't see any bills in a Medicare side.
But how much is it to pay a month for that?
It's the Blue Cross plan, which is the cheapest plan available,
Yeah.
is $191
So
a
if you
month.
add that to the regular,
To the 134,
you're paying almost $300 a
you're
month.
paying almost $300 a month.
People on fixed incomes can't do that.
They can't do that.
So they luck out from
People are,
Medicare.
well, I can't say, there's the Medicare Advantage option for folks that plans are cheaper.
Yeah,
They're gonna have to pay during the year.
sure.
And the Medicare Advantage plans, if you have higher income, and if you're sickly and you use the system a lot, it's a good program to be in.
Yeah.
And that's where the standalone drug plans come in, because people that have Medigaps have to pick up a standalone drug plan.
You must have people when they come to you for the first time, their mouths go,
They do. Well, that's to be honest with you. They do. It's a complicated thing. Even people that have been in Medicare for a number of years, we explain these programs every year, and they don't understand them. It's just a constant re-education of folks, I think, in how the system works.
isn't there any way they can streamline or simplify the system for these seniors? I wish.
We all wish.
Yeah.
Medicare, the workings of Medicare, Medicare, first of all, is certainly a bureaucracy. It's controlled by the Centers for Medicare and Medicaid Services. They're located in Baltimore. But Medicare regulations, in a lot of cases, no matter how small they are controlled by Congress. So if you want to change Medicare to any large degree, you have to go through Congress to change it.
Good luck right now.
An example of that is that whole bit of business I talked about the observation.
Yeah.
And in order to change that, that has to be voted on by Congress.
Yeah.
Believe it or not, it's
And
an unbelievable
what is
concept.
COLA? C-O-L-A. What is that?
COLA is a cost of living allowance, and I'm glad you saw that.
Yeah.
Because I certainly can announce today that, and a lot of folks have seen it, that your Social Security check is going to have a 2% increase in 2018.
Oh, wow, that's
And
a lot for people.
And I know everybody's excited by that. So that's great. It's good news. But previous 2 years, though, actually we go back almost 3 years, we haven't seen much at all.
Yeah.
I think 2 years ago we had 0. Last year we had a large 0.3 of 1% increase.
Why are
It
they
was
so
about 30
meaky?
cents.
What is this?
2%?
2%? That's a joke.
That's what they come up with. That's what the trustees come up with. We have no control over that.
What are these trustees, millennials? And they can't.
Whatever they are, I don't know, but we have no control over it. So we're going to get a 2% increase in our Social Security check. Wonderful. But some of us that are 60 will recall that we didn't get any real raise the past few years, and our Part B premiums did not go up much. In other words, I mentioned the $134 premium.
Yeah.
That's for 2018. But a lot of folks didn't really see a lot of it. When you don't get an increase in your Social Security check, you don't get an increase in your Part B premium.
What a racket.
No, it's a good deal, Jan.
Oh.
I'm going to tell you why.
Only if you're an
That's-
SSI or SSD. That's really good.
No, that's the result. That's the result. That's a law.
Yeah.
That's a law. You're grandfathered in, okay? It's a hold harmless provision of the Social Security Act.
Yeah.
And that simply states that your Social Security check cannot be decreased as a result of an increase in a Medicare premium. So that's great news because these premiums could have increased a couple of years ago.
We're talking with Ed Roth, and he is program assistant for Shine, and he's located in Milford. And there's a lot of us, including myself, who aren't that up on what Shine can do for people. You even get into prescription advantage, health safety net reminders. What is that all about?
Okay, well, a health safety net program is a state program, okay? Way that works is it's a good program, okay, and can help you with your hospital co-pays and actually any medical services you get. You qualify for the health safety net by having income lower than 150% of the federal poverty level. Right now, that is around $1,500, between $1,500 and $1,600 a month.
A month, okay.
And if your income is that low,
Yeah.
and you apply for health safety net through Mass Health, you could have your hospital deductible paid for by Mass Health. Okay.
All right, that's good.
You could get all your medical services. If you get all your medical services at a community health center,
Yeah.
like the Edward M. Kennedy Health
Yeah,
Center down
right.
in Milford,
Yeah.
you get all your services there. Then you don't really have to join another plan. The health safety net will pick up the cost
Automatically.
of those services. Okay, so again, health safety net's a great program. The first level is from 0 to 150%. There's a partial level that goes from 150% to 300% of the federal poverty level, and 300% of the federal poverty level is around $2,900 or $3,000.
And how do you keep this in your head? Honest to God, how do you do this?
Oh, it's a trick.
I'm telling you.
But that's what's available
Yeah.
to folks. Again, all of these programs are available.
Yeah.
So it's not, and it depends on people's circumstances. Everything depends on an individual circumstances, whether it be a drug plan. I mean, I certainly wouldn't have the same drug plan as my wife does, and did stuff like that. So, it's all individual services.
Ed,
every bit of it.
how can people reach you?
Number is, you can call us at 508-422-9931. You can certainly go that route. If you want general information, we do have in Central Mass, we've established a website, and I think it's pretty cool. And that is www.shinema.org. You certainly go on that website and get some more information about the stuff we've talked about in this program.
Is Shine, we got about 2 minutes left, is Shine in bed together with AARP?
No.
Okay, so they're totally separate.
Shine is an independent, totally unbiased, independent organization that is not aligned with any insurance company or anything like that. We're funded by a grant from the Federal Administration for Community Living.
And it's free for those who
And
seek
it's
it.
free for anybody. That grant goes through the State Executive Office of Elder Affairs,
Yeah.
granted out to community nonprofits, like in our case it's the Friends of the Milford Senior Center,
Sure.
who have that grant to administer the Shine program in Central Massachusetts. 14 programs throughout Massachusetts. Nationally, we're known as SHIP programs, state health insurance programs, and they're required in each and every state.
With the baby boomers and the Gen Xers coming up in droves now, you'd have your hands full, I think, even more than before.
It's going to be busy, and
Yeah.
and it's busy right now, but we do the best we can. We try to help people and send them off with as much positive information as we can.
Ed, I want to give you a little plug. You have a television show on our Milford channel up the street.
We have a TV station. It's called a TV program called Medicare and More. We're not on as regular as we don't produce the program as regular as I'd like to, but we're available in communities throughout central Massachusetts, and we invite you to watch it. If it's not on your local cable channel, give them a call and see if they can get it on.
Well, we do. Our co-producer, Glenn Fowler, does a great job. He gets you on. I know, when I've turned it on, I went, that's Ed.
That's me.
You do a great job.
Well, we try hard to
do.
get the information out.
You do.
And we do various subjects of
Yeah.
importance to people throughout the year.
Ed, thanks so much for being with us.
Jan, thanks for having us.
Come back?
I certainly will.
I got him
Okay.
hooked. That's good. Thanks so much.
Bye, Jan. Thanks a lot.
See you next time. I'll be my
Yep.
guest. Good job. All
How'd I
right.
do?
Great.